Okay, perfect. Hello, everyone. My name is Carlos. I'm a family physician from Portugal. And today I want to talk with you about this question. Why not develop, translate, and apply EAPC Toolkit in your country? I think the first question is why to talk about palliative care in primary care? Why to talk about primary care in this webinar? It is generally we identify patients with palliative care needs later in the course of their disease. And this brings us worse prognostic and capacity to intervene in patients and in their families. Well, maybe primary care can be the answer, or at least a part of this answer. Primary care has this unique potential palliative care to all patients with all illnesses at all times, in all settings, and it has this peculiarity, this strength. It is present in all countries. So I think for all the enthusiasts care and primary palliative care has a role to do in this palliative care setting. This was taken from the toolkit. There are identified barriers and opportunities, and I'd like to focus in the opportunities. We have worldwide not only GPs but also healthcare professionals motivated to participate to develop palliative care in their own countries, in their own settings. Many policies and guidelines start to appear, educational activity starts to appear. We start to talk about this so important theme, which is advanced care planning, and we are developing research about palliative care, which is essential for its delivery supported by evidence. And this is the first topic I would like to talk with you. These barriers and these opportunities are not that different from my country to your country, to your neighbor country. So we have a global theme to work about. Yeah, but you can say these changes need a huge support, a huge amount of money. It's very difficult. Yeah, maybe it is. But all big transformations can start with a small piece, step. And I think each of you, me, everyone, can try to be this small step, this small piece. Well, what about the toolkit? The toolkit wants to be a practical guide to help both national leaders and healthcare providers, healthcare professionals to develop palliative care in primary care setting, reaching opportunities, enhancing and reaching also the barriers. It provides relevant documents about national policies, also validated tools to identify and monitoring patients. It may be not the holy grail, the solution to implement palliative care, primary palliative care, but it is an important tool which has been already constructed, developed, so we don't need to start from zero in every country. And you can say, yeah, okay, but there are some countries more developed than my country. Yeah, that's it. But as I said before, the reality, the worldwide palliative care setting is not that different. There are lots of barriers and lots of opportunities which are similar in my country, in your country, and every country. But yeah, maybe it's time to stop to talk in abstract and share with you a little bit of my experience. How did I get to the EAPC Primary Palliative Care Toolkit? Well, I was sharing some academic paper about family physicians' role, about family physician perception, about their role in primary palliative care with Professor Scott. And we were chatting and he asked me, what about to translate EAPC Toolkit? Yes, I was a little bit ashamed because I didn't know the EAPC Toolkit. So I Googled it. I was trying to understand a little bit more what it would be, this toolkit. And surprisingly, when I was reading the document, I understood this barriers, opportunities, the needs in every country, in European countries, but worldwide countries are not that different. So I didn't know if it would take too much work, but I said yes. And fortunately, I said yes, because all the process was very light, was very smooth, because Primary Care Reference Group gave a huge help, from the review, text formatting to text editing. So I think we translate and we create the Portuguese from Portugal version of the toolkit, maybe 3 weeks, 1 month. The process was very clean, was very clear. So it was not that different. It was not that difficult. It was easy. And this small step started to make a transformation in palliative care setting in Portugal, in primary care setting in Portugal. Why? Because more than an academic translation of the toolkit, it was shared with the Portuguese Association of Palliative Care, shared by their members who received it with great enthusiasm, and it's being shared now. So this toolkit reaches a lot of people, a lot of physicians, lots of healthcare professionals in Portugal, in primary care in Portugal, and there are small changes already happening now. So why not? Why not develop and translate this toolkit in your country? This is a very good history, and I feel privileged to be part of it. Before me, Professor Maria Bori performed the Greek translation, and after we both do our language translation, Renata is performing Brazilian translation, and this is huge. It's not only about Portugal or Greece or Europe. It reaches Brazil. It's not European, it's worldwide. And it's very easy. We are talking with Renata, and his experience of translating and formatting is as much as smooth as mine have been. So why not? We developed a small blog published in the EAPC Primary Care Reference Group, and it ended like this. Will you engage with the toolkit and take it to your country, your language, your patients and families with palliative care needs? Accept the challenge, and the EAPC Primary Care Reference Group will support you to do this. And I'm very privileged to be part of this, and I want to encourage you to do this. And whenever I can, I will help to do this translation, to this test formatting, test editing. If I'm not able to do it, we can reach someone who can help. So do not feel struggle with difficulties, or do not think it's a huge amount of work. It will compensate. Yes, it will compensate. And if you don't believe me, please just download the toolkit and read it. And you will understand that it's not a Portuguese problem, it's not a Greece problem, it's not even an European problem. It's a worldwide opportunity, and we all can give those small steps. Why? Yeah, because primary care can really cover everyone for palliative care. As I said, maybe not the holy grail, not the solution for all problems, but yeah, we can be this umbrella that shelters every patient and every family with palliative care needs. So why not? If you want to, just go to EAPC Primary Care Reference Group website, read the toolkit, read the small video which has an explanation about the toolkit, and talk with us, email us. We'll help you to do this, to take this to your country, and to do what I think it's most important, to reach every patient and every family with palliative care needs. You can be the help in your country. So thank you very much.
Thank you, Dr. Carlos, for sharing your experience. And in the meantime, I have noted that Joanne has shared the English version of the toolkit, followed by the translations into other languages. So, and now we are open for questions as well from Dr. Carlos. You could.
Could I maybe mention just one thing, Shaman?
Yeah,
thank you.
Sure.
The first translation of the first toolkit was made in 2015, and a number were translated then, most of the major European languages French, German. So in fact, there's one or two that need updated. So people doing those languages have got the one that we should update after 4 years. But we're starting again with the more updated toolkit. So just let you know that. And also there's a link, there's a 1 minute, 10-second video, which goes with that penultimate slide that Carlos showed there about the toolkit. If you're explaining it to a team in your country, it just shows how the toolkit can be brought together as a summary that can be used with a team. Thank you. I think that a link to that will come up on the chat.
All right. Yeah.
Back to you, Chema.
Yeah, so you may post your questions on the chat box, or you may unmute yourself and ask your questions yourself.
I'm not sure if the unmuting actually will work, but please just unmute to capture the questions as they come through there. Yeah.
Okay. Sure. So
there was one question I see here as well, Chema, that came in before. How can we develop primary palliative care for nurses? That's a question out of left field, you could say. But how could we maybe respond to that? You know, yes, you're a doctor, but how can nurses be involved in this?
I think nurses should be involved in this. We may talk about care, but palliative care, because there are lots of things, lots of needs. So GPs help in some pharmacological, non-pharmacological approach, even knowing and care context their social needs, but nurses have a huge with this as a multidisciplinary team. So I think when we talk about primary, we are talking about GPs, talking about nurses, we are talking about social assistants, multidisciplinary team, which is fundamental. I believe maybe we will not be able to promote the health of everyone. There are lots of steps that nurses can help develop. There's some kind of treatment, some kind of approaches, maybe even pharmacological approaches. Nurse can be differentiated, can help. The here is very important. Capacity to mobilize something, to understand some patient symptoms, to raise the lots of stuff when a nurse may be more active than a GP. So I think palliative care must be, or primary palliative care, every patient needs, and each part of multidisciplinary team should address what they are better to do it. So if I'm not comfortable with the mobilization of, which is lying in bed, but my nurse of my care team do that, why not involve her or him in this process? Because the is always the quality of life we are promoting to patients to care needs. Not all about me in my medical, about everyone to start his small piece to bring this good and beautiful life. I think should involve in this.
Right.